Good day, grade 9. Today is our MAPEH 9 Health in the fourth quarter, week 4. My name is Mr. Rinaldo B. Malimban. Last time we talked about in week 2 about the emergent procedure. So having these accidents can be avoided by taking simple safety precautions at home, at work, on the road. But the awareness and common sense are the key to accidents prevention and treatment. So a good first aider must possess the basic knowledge of administering first aid. Like the Heimlich maneuver is an emergency procedure designed to expel an obstructions from the victims of airway by producing in what? From the cardiopulmonary of CPR. In the technique of alternates artificial respirations and the chest of compression to revive the victims who have no pulse. So that is the end of the chapter from the view in week 2 in MAPEH 9. And today's lesson, we talk also the objectives, the main objectives that the student to be able to provide the information about the substance abuse and to assist students in understanding the symptoms and consequences of substance use and abuse, to motivate students to make informed choices about the substance use and abuse. Let's move on our topic, the substance use and abuse. Our part 1, let's talk about the substance use in addiction. The abuse of substances such as the coffee, tea, alcohol, from wine and some regulated drugs in tobacco can cause emotional and health problems not only to the individual user but also the family up to the community. So in the substance use and addictions, many physical mental health problems are directly related to the use of alcohol, tobacco, and other drugs. So the misuse of anything to the point of endangering one's health can be termed as substance abuse. In many cases, substance abuse can lead to addiction, a condition that occurs when the body develops either physical or psychological defense on substance. Now, what is drugs? Drugs are any substances or chemicals which, when taken into the body from the nasal, oral, transdermal, have the psychological, emotional, and behavioral effects on a person. Drugs are the compounds which may be in the solid, liquid, or gaseous form. So this medical drug is a kind of substance that may be a pure of chemical, natural, or artificial mixture of products. It is used in treating various kinds of ailment. A drug also alters the mind of the body in some way when taken or used by individual. So these solid drugs include the granules, tablet, capsules, candy, powder, cream, and ointment. And that is the liquid drug. That include cup mixture, antibiotics, and injectable solution. While the gaseous drug includes some general the anesthetic inhalers and also the bronchodilators. And there are some substances also are chemical this component. other than food which is taken into the body has laxant, stimulant, or to relieve discomfort. These substances affect the physical and mental health of the user like coffee and tea, the alcoholic beverage, nicotine and tar from tobacco, and also the regulated drugs. So unregulated use of these substances could lead to addiction. There are two types of addiction. But before that, what is addiction? Addiction is a continued repetitions of a behavior despite adverse consequences. And these are the types of addiction. One is the physiological addiction. It is a condition where mind sends to the body the message that it needs more of the drug, while the physical addiction is the condition where the body itself develops the needs of the drug. Also, we include the types of the behavior addictions. Number 1, the codependency, food and eating, gambling, sex, internet and games, debate, shopping, work, love are the behavior addiction. Let's move on another view about the risks and protective factors for the drug use, misuse, abuse, and dependence. In the risk factors are those influences which increase the chance of using, misusing, and abusing drugs. Are the protective factors are those influences which increase the chance of using, misusing, and abusing drugs. In the protective factors, we have to check the good communication with the people, positive family relationship, clear and consistent family rules, strong family values, positive expectations to the child's success in family, school, and community, and the reliance of the family for emotional support. The use of misuse and abuse of drugs are the result of the various factors surrounding a person. Of this factor either increase or decrease the possibility of a person to use drugs. So this drug used to treat disease and to restore health. Drug companies also produce drugs to relieve psychological problem. How to tell if someone is on drugs and which ones? So people who hurt themselves with drugs belong to one or two groups: drug misuser and drug abuser. So these factors are composed of influence in the different domains of life. The one is the personal, the second is the family, the third is the peer and friends, fourth is the school, and the last is the community. In the personal, early aggressive behavior versus self-control. This risk factor of person's use of drug at an early age, risk-taking behavior, experimentation, poor social skills and interaction, childhood problems, feelings or isolations. In the personal protective factors that include self-control behavior, good reasoning skills, excellent social skills, positive interaction with people, and the sense of belonging. Next is the family. The weak of parental guidance versus strong parental guidance. Only risk factors in the family. We have the history of the patterns of the drug use, attitude toward drugs use, poor parenting and child rearing, inconsistent family rules, poor family values, and the poor family ties. In the first and friends, substance abuse versus academic excellence, we have also risk factor, the associations with the peers and friends known to the use getaway drugs or cigarettes and alcohol. Preference to stay with the peers and friends than with the family. School. Disavailability of drugs versus strong anti-drug policies. In the school risk factors, we have poor academic performance, lack of commitment to the studies, poor attendance in school, involvement in fight and conflicts. In the school protected factors, good to excellent academic performance, joint extracurricular or extracurricular activities in the school organizations, and shows interest in attending classes like the class. Next is the community, misleading neighborhood. In the community risk factor, the point is the alcohol, other drugs readily available, responsible servers and sellers. Laws and ordinances are unclear or inconsistently enforced. Norms are unclear or encourage use. No sense of connections to the community. Neighborhood disorganization, rapid changes in neighborhood, high employment, residents at or below the poverty level, and the lack of strong social institution. But we have two protective factors in the community. The one is the opportunities for community involvement, community religious composition, laws are consistently enforced, informal social control, policies and norms encourage the non-use, community service opportunities, resources like housing, healthcare, childcare, jobs, recreations, etc. or whatever available. And also the comprehensive Rex Focus program available for the youth, programs for the parents or children and the adolescents. Drug misuse and versus abuse. In the drug misuse, means using a drug in a way other than how it is supposed to be used, while the drug abuse means using substances that are against the law or not supposed to be taken into the human body in drug abuse. But some drugs that are abused have no medical purpose at all. Why? Because some people who misuse by use drug without following direction, change the amount of drug without first getting to the doctor's approval, or use drug prescribed for someone else and use drug for longer than a doctor advice. But if the people who are abuse drug, they use a drug for purposes other than medical use, such as to get high, taking a substance that was not meant to enter the body, and use the drug in the way that hurts the user's mental, emotional, or social well-being. Another in the drug misuse versus drug abuse, drug misuse is to accidental unsafe use of a medicine. Example, you have an ear infection, so a doctor prescribed medicine for you, but you are supposed to take 2 pills each day. You take 4 pills by mistake. If you misuse a drug, tell your parents or guardian right away. They can decide what to do. By the drug abuse is the use of an illegal drug or UR. Then the harmful use of a legal drug. Drug, legal and illegal. So these are some instructional aid on a drug for our education. In the legal drugs, there are many substances that you may not have realized were drugs. Legal drugs include all of the non-prescription over-the-counter drugs that contain the chemical for treating medical problems. But some drugs such as alcohol, the caffeine, the nicotine are legal but may be subject to restrictions based on age, location of use, driving, and point of the sale regulations. We regulate and controls the active ingredients in the legal drugs that the alcohol content of drink. But aside from that, the prescription drugs are legal drugs that are controlled more strictly than over-the-counter drugs because they are stronger and more dangerous if abused. A doctor may prescribe them to the particular patients for a specific medical reason. Use care in taking prescription or over-the-counter medicines. Read the directions carefully and follow your doctor's advice. While the illegal drugs impact of this addiction, illegal drugs are considered so dangerous that the law forbids selling or possessing them. These include the marijuana, heroin, cocaine, and cracks, the most addictive form of cocaine. Very dangerous drugs may cause of severe illness and even death because they cause extreme changes in the body. What? The smoking marijuana caused even greater lungs damage than smoking tobacco. The heroin causes heart and lungs damage, skin abscesses, and a general breakdown of the entire body, and the lowering of resistance to the disease. A heavy dose can bring on convulsions and death. Cocaine or crack are substances that can cause heart attacks, mental breakdown, convulsions, and death. So, that are some few of dangerous drugs that are sold illegally. An additional risk in the drug capsules or needles may be dirty and carry life-threatening diseases. So the term of illegal use of drugs, means of use of drug, the possession of this or distribution, a drug of substance that affects that way the body functions. If the drug is classified as illegal, this means that is forbidden for the law. Our thoughts for today, according to Zero Error, addictions of a person is more dangerous than a drug. That's all for today. For more updates and clarification, please send a comment of my personal messenger. Thank you. My name is Mr. Rinaldo B. Manimban.